orientation, this is the heart, this is the very top of the liver, and this is more of the liver. And in the liver there are two primary abnormalities. So this white region right here and this one here are actually liver cancers or hepatocellular carcinoma within the liver. And it was decided that the best therapy would be a chemoembolization, which is the infusion of chemotherapy to the lesions with the intent to kill tumor. So following the conference, we brought the patient to angiography, and this is a representative image. So just for orientation, the spine is here, liver primarily is over here, and this is in a blood vessel that supplies blood to the liver and spleen. And so these images, this is now subtracting the other structures away. I'm just rolling through them here in sequence. This structure over here is the spleen. Over here to the right, to the left of the screen, but the right of the patient, is the liver would be in this region, and we're now seeing these two balls, and they correspond to the two areas of abnormality I showed on the previous CT scan. So what's happening is these areas are hypervascular. That's our way of saying that these tumors have more blood supplied to them than, say, the more normal liver around them. Now we've gotten into the blood vessel that supplies more specifically the liver alone, and we eventually will take a small catheter into the blood vessel that supplies one of those two lesions primarily. So now we have a very small catheter into small blood vessels, injecting that, and at this point we see that we have the primary blood supply to this tumor. So once there, we then can distribute the chemoembolic agent, which was a combination of a chemotherapy and material designed to plug up the vessels. So these images here are taken after the chemoembolic has been given, and you can see that there's a fairly significant reduction in the blood supply to the tumor. That just sort of shows us we've blocked off those blood vessels. More than 2 years after this, in the vicinity of the lesions that were present before, you'll now see a relatively white ball. One of the two components that we administer, one of the embolic components, will show up on a CT scan as being white. And so this is just the residual of what was injected 2 years ago. And that portion of tumor is dead. We then give the patient contrast and repeat the study. And so these images, should there be any live tumor, would have areas that enhanced or were white in addition to what was seen on the former sequence. And so this tells us that we've effectively killed that tumor areas and there's no further regrowth